Value-based healthcare at its roots understands that not all healthcare is created equally. What we're trying to do is find ways where we can increase quality and decrease cost. What we're trying to do is coordinate and deliver services really on a whole person level. We're trying to take a look at the person, the family unit, the delivery system, and make sure that the care is coordinated so that the patient receives the best in care. It's the morally and ethically right thing to do, but it's also the only way that we're ever going to balance our budget.
First of all, describing value-based healthcare in one sentence is a challenge, but let me first just make a couple of comments about the words of value-based healthcare. What comes to mind is both holistic, so big, and molecular, small. So, value-based healthcare from my perspective is an approach to valuing health that is intrinsic, is integral to the organization. It permeates the organization. It influences how the organization takes a look at health, and so it takes a look at health from a design perspective, from a wellness perspective, from a risk management perspective. It just takes a look at the whole picture of health.
I'm passionate about value-based healthcare. I really believe that the delivery system needs to be improved in terms of the quality of the delivery of services. We've done a lot with healthcare reform, but it's been insurance reform. We've given access to a fundamentally broken system. What we now have to do is align incentives so that the delivery system is incented to work for our membership, on behalf of our membership, to coordinate. We don't need to pay on a piecemeal basis any longer. What we need to do is pay for outcomes. We need to pay for health, not simply services provided.
I believe in value-based healthcare because it is the only way that will simultaneously promote and improve health for people in an organization, but also help reduce costs. There's a direct correlation, in my opinion, between quality of health and life and corresponding low cost, and that might seem counterintuitive, but it's exactly the opposite. The more you value health and promote it in an organization, the less cost you have to provide to caring for your employees and their families.
Well, I think value-based healthcare is really the only way we're going to balance the budget, and balancing the budget really leads to, I think, a way that we can start to incent folks towards moving to better health. The goal we should all have is simply expressed: sudden death in overtime. That is, we want to live well and we don't want to die in a chronic disease state. And so when we take care of ourselves, we end up meeting that goal, sudden death in overtime. And we don't have long periods of disability that end up really impairing the quality of our lives later in life.
Value-based healthcare can help organizations by both reducing cost and improving health. And of course, with improved health comes improved productivity, improved presenteeism, so people are actually more conscientious about the work that they're doing, more present for doing that work. So the big picture is that it helps financially for organizations, but I think more importantly it promotes the health of employees and retirees and their families.